on the race to curb the spread of polio in Gaza. Let's bring in Dr. Hamid Jafari. He's the Director for Polio Eradication for the World Health Organization in the Eastern Mediterranean region, and he joins us live from Amman in Jordan. Thanks for speaking to us on the News Hour. Just really briefly, if you would, remind us what exactly polio is, how it affects people and how it spreads.
So polio is a virus that infects those who don't have immunity to polio, and a fraction of people who get infected with polio virus develop paralysis. It's called poliomyelitis. This is an infectious disease that spreads through what we call fecal-oral transmission. So that fecal contamination, directly person-to-person transmission, is the predominant route. And as you can see these images from Gaza, there is so much exposure to sewage that the children are at high risk of extensive exposure to polio virus, because the virus is excreted by infected individuals in their feces, and it's the predominant route of transmission is fecal-oral transmission. Basically, the paralysis is permanent. There is no treatment to cure the paralysis because the nerve cells are destroyed by poliovirus. It can only be prevented by vaccination.
Okay, thank you for that. In 2022, the WHO said that for Gaza, the polio vaccination rate was 99%, and it's now fallen to around 90%. I just wonder, that is quite a big drop in quite a small space of time. Can you explain to us, obviously the war's been going on, but how has it dropped so quickly?
Well, the immunization coverage with the polio vaccine was really very high in Gaza. But after the start of the war, many of the hospitals that provide services are no longer functioning. Less than half of the 107 primary healthcare facilities that provide vaccination for children are no longer functioning. Children and families are getting extensively displaced and are not able to consistently get healthcare. Those are the obvious reasons why the vaccination rates have dropped, and they're obviously dropping most in the youngest children who get their childhood vaccination in the first 6 months of their life, the initial doses for polio. So because of the disruption of health services, vaccination services have been also severely affected. And children now are living in conditions that are highly favorable for poliovirus transmission. I mentioned the exposure to sewage, but also overcrowding, displacement, constant move, malnutrition. All of these factors contribute to efficient poliovirus transmission.
So we're hearing that 1.6 million doses of the polio vaccine are being made available. I understand they're not in Gaza yet. I suppose, how does one even begin to organise an effective immunisation campaign in the circumstances that you've just described in Gaza, with people moving around from pillar to post, never in the same place? As you say, healthcare services significantly disrupted. How is that even going to be possible to organise?
So the Global Polio Eradication Program has extensive experience in vaccinating children in settings of conflict. So the program knows how to do what we call micro-planning to, for a given period of time, make a very clear and detailed plan of where the families and children are and what would be the modalities to provide the vaccine, whether it's through house-to-house vaccination where appropriate, or through reaching out to community centers, to health facilities, setting up temporary fixed sites. So the plan is very appropriate to where the children are in a very specific period of time. And the campaign is most successful when it is completed everywhere in a short period of time, so that you're not staggering the campaign. Otherwise, children are constantly moving. Unvaccinated children come to the areas that have already been vaccinated. So this all has to be done in a short period of time. So the program knows how to plan to deliver the vaccine. Of course, what is not in the control of the program is the environment in which this is implemented in terms of peace and security. And that is why the polio program has been involved in negotiating days of tranquility, corridors of peace, cessation of hostilities, and ideally a long-term ceasefire. So the plans are ready for the implementation of this of the first vaccination campaign at the end of August. We are now in a stage of coordination where the authorities are coordinating to see how best the hostilities can be stopped and an environment could be put in place whereby health workers can move, vaccines and supplies can move, and most importantly, communities can come to health facilities to get their children vaccinated and protected against polio.
Just really, really quickly, because we're out of time, we've already had a confirmed case. Do you think this programme can be implemented fast enough before we see more children contracting this terrible illness?
You know, we could have prevented this case of paralysis if we had detected the virus earlier and started sooner, but the surveillance system to detect polio virus was also disrupted as a result of war. So in some ways, we have already failed a child and potentially more children. So the earlier we can get started in vaccinating the children and implement the vaccination campaign rounds where we need to reach more than 90% children, the sooner we'll be able to stop this outbreak, protect more children, not only in Gaza, but also in Israel, in the West Bank, and in surrounding countries.
Dr. Hamid Jafari, thank you so much for your time, and I wish you and your colleagues the best of luck with that immunisation programme.